The following program is being presented to you by a community producer. The statements, views, and opinions expressed are not necessarily those of ALC TV or the City of Avon Lake.
Welcome to Common Sense. The Common Sense program is a series of shows featuring interviews with very interesting people. And that's so we can learn in a clear, concise, and direct way who these folks are, what they do, and what makes sense to them and what doesn't. I'm Rudy Breglia, and today I'll be interviewing the wise and caring Dr. Kellie Deeter, current candidate for Ohio State Representative in the 54th District. Kellie, welcome to Common Sense.
Thank you for having me today.
Okay. Well, to start us off, give us some background. Where were you born? Where have you lived? That kind of information.
Sure. I grew up in Bellevue, Ohio, so I was born in Erie County, adjacent Erie County in Sandusky.
All right.
Lived in Bellevue, into a couple different, Bellevue's a 4-county city, so went from Erie to Huron County. Then moved to Monroeville after I graduated from college, undergraduate, and then moved to Norwalk about 25 years ago, and I've been there ever since.
Okay. Well, tell us about the joys of having a large family.
Yes, we have 6 children between the ages of
Wow.
12 and 25. It's very interesting. It's organized chaos at our house, so we run it like a business. It goes we love it. I mean, we're always busy. There's successes and failures, and we learn and we all move forward together and we enjoy being busy all the time.
Okay, well, before we get into it, what's the secret for handling disagreements at home on rainy Saturdays? I have personal experience.
That's a great question. I would not say there is a secret. I would say that, you pray initially for a healthy marriage, then healthy children, and you go from there. Build your family on love, trust, understanding, faith, and like I said, we run our house like a business. So, we do have fun, but they know Mom runs a tight ship. So there's not a lot of tolerance for disagreements. When there are disagreements, though, you can always remove electronic devices, and that will work very quickly.
I see. Okay. Well, why did you pursue a career in nursing? So
I was born with some innate sense of advocating for people from as far back as I can remember. My grandmother was a quadriplegic. She had polio in the early 50s. So my mom took care of her most of her life. My mom was only 1 when she got polio. So then, I didn't know it, but I took care of my grandma a lot. For me, it was just spending time with my grandmother, and I didn't see her as disabled. But I enjoyed very much taking care of her, and I didn't view it as work. It gave me a sense of pride helping her, and that carried through really in everything that I did.
Okay. Well, tell us about the steps in your career.
So I initially set out to be a nurse. In my family, not very many people went to college, so I was one of the first. So while I had aspirations of being a doctor or a lawyer, it was recommended, you should probably start with teacher or nurse. Back then, it would be 70s, 80s, they wanted you to reach high, but not too high. They wanted you to be able to achieve.
Okay.
So went to undergraduate at Bowling Green State University and Medical College of Ohio, right out of high school. Then I began working as a nurse, was a first assist in surgery for 10 years. That is where I was exposed to anesthesia providers, knew that I wanted to further my career, and went to graduate school at the University of Akron,
Okay.
Master's program in nurse anesthesiology. Started practicing as a certified registered nurse anesthetist. It's a mouthful. And then I did go back for my doctorate degree at Maryville University in St. Louis.
Okay.
So, and I also became a nurse practitioner during that time as well. I
Okay.
added that certification on.
Wow.
So,
What was the most surprising aspect of being a nurse?
I would say the most surprising aspect is that, especially for nurses, you go into nursing because you feel that it's altruistic in nature, but really healthcare is a business,
Okay.
and it is run like one. So I think that was the most surprising.
Yeah.
Yes, I did not want it to be true, but
It is. Okay. What makes a good nurse?
I think a good nurse she's smart, she or he is smart, organized, and probably the biggest quality is one that can prioritize. I think
Okay. Yeah,
that's,
real important. Tell us about the small business you created.
So I own an anesthesia group. We have about 8 to 10 certified registered nurse anesthetists that
Okay.
cover anesthesia services for hospitals and surgery centers in Ohio. So we provide the full service of anesthesia in every setting that we're able to work, and we do every type of anesthesia for every procedure. So
Okay.
that's what we do.
All right. Then. What stimulated you to start your own business?
I saw the need, and I'm not afraid to take risks. I'm not afraid to fail,
Okay.
and I have an unwavering determination about me, if you will.
Okay.
So
all right. I could see
I
that.
will generally make things successful, and if I don't, that's okay. So
Okay. How did you reach your decision to run for Ohio representative?
So that's a little bit of a longer answer. I began as a nurse, and I began as a healthcare provider a total of 28 years ago, but I started giving anesthesia 18 years ago. When I began that career, early on in my career, I faced a restrictive attorney general opinion in all nurse anesthetists in the state of Ohio did. So we received a cease and desist from then Attorney General Mike DeWine, and he interpreted the statute strictly to say that we could no longer do what's called write orders for patients before and after surgery.
Okay.
We had the full ability to provide anesthesia care during surgery, but prior to and after, because of the advent of nurse practitioners who got explicit authority in the revised code long after nurse anesthetists, we did not. It was interpreted that we did not have explicit authority to do those things, even though we had been doing them for 150 years.
Okay.
He interpreted the revised code strictly to say that we could not. So, in well over 150 practices in the state of Ohio, we all of a sudden on Thursday
Couldn't
could
do it.
practice and
Yeah.
Friday could not. So. And we could go to Michigan today and practice. We could go to Kentucky today and practice fully, but Ohio restricts practice. So those are barriers to care for our patients. I had to look those patients in the eyes, every day. The facility still expected you to provide the care. The budgets are tight, especially for rural healthcare. So we had to find inefficient workarounds to see that the patients got what they needed and still received safe anesthesia care. So that's when I became much more civically involved.
Okay.
I started grassroots initiatives to show all of the legislators in the state of Ohio what we do in an operating room in their district, and show them what the Attorney General opinion, how it restricted our practice and resulted in inefficient patient care. So I took well over 80 legislators, and at that time, that was 2015, I believe. We started those visits. I drove all over the state, showed them the issue, and they all said this was common sense, no-brainer. And they were
Name of the show.
They were well aware that we, needed to fix this minor nuance, and they said, "But good luck. It's going to be a heavy lift. You have to insert politics now." So it did take me 6 years to pass simple legislation that would restore our scope of practice and ability to take care of our patients. So after the 6 years, I had experience passing legislation, and learned the intricacies of policy making, and I was successful at it. So I asked myself, what am I going to do with this experience? I'd worked with so many legislators and built relationships with them, and other lobbyists, lawyers, organizations, trade associations, and I actually became the government relations director for the Ohio State Association of Nurse Anesthetists, just as a volunteer. And I just stepped down from that role to run for office. So, the seat came open.
Yeah. It's a very natural evolution.
Yes.
Yeah.
Yes. The seat came open, and they only come open about every 8 years if the person's doing a good job. So, if you would have asked me 10 years ago if I saw myself on a ballot, my answer would have been a short and quick no. 5 years ago, if you would have asked me, I would have said maybe. And now, here I am.
Okay. Did your endorsement from Dick Stein, the current representative, help your decision?
Absolutely. If I didn't have the support of, the representatives that I spoke with and the colleagues that I've worked with, they didn't hesitate to throw their support my way. Just having worked with me on legislation in the past, if they would have said, there's somebody that will do a better job, I would have absolutely deferred to that person, to do what's best for Ohio.
Okay, well, that's wonderful. What are the primary responsibilities of a representative?
Good question. It's my understanding that we pass laws for, the state of Ohio, as well as set budget appropriations, set the budget and biennially, and we determine where those funds are going to go across the state, and operating budget, capital budget, transportation budget, and those are the primary roles.
Enormous responsibilities. What characteristics should voters be looking for in a candidate?
Some of the same qualities that they look for in a good nurse. Smart.
Yeah, I noticed that.
Organized, one that can prioritize.
Okay.
Good listener. An analytical person. We're only experts in, our professional area. So of course we're going to be writing laws and making laws and weighing in on laws that affect, a lot of other areas. Energy, for example, something Representative Stein is an expert on, whereas I am not. You have to be able to commit to analyzing those issues and delving into them pretty deeply to get a good enough understanding to, be impactful and make a good decision on pieces of legislation that you'll see.
And I think you've answered the next question. What best prepared you for being a representative?
Definitely my experience working with the legislature, failing 2 General Assemblies, succeeding in the 3rd.
I see.
Learning, failure is it will
Part
give you
of
good direction. A tough primary will give you good direction in a general election. So
Understand.
I've also got to experience that.
Okay. How are representatives assigned to committees?
In general, it's my understanding that leadership, specifically the Speaker of the House, will, assign you to committees. In general, they are commensurate with your professional expertise, but not always. So I would certainly expect to be a member of the Health Committee or Health Provider Services Committee, possibly Medicare, Medicaid, possibly insurance. But I would also like to be a member of the Agriculture Committee, just because our district relies heavily on agriculture as well as rural health care. So one I'm an expert in, and the other I'm committed to becoming an expert in.
Okay, learn about it.
Yes.
Okay. Tell us about the current state budget, and what are some of the items that would be impacting your district?
So the current state budget, budgets are done, the operating budget is done biennially on the odd years. The capital budget is done biennially on the even years. So this is a capital budget year. So currently we're asking for appropriations in the capital budget for the Lorain County Fairs Forever project, which is a wonderful project that will expand the Lorain County Fairgrounds, which is the 2nd largest fair in the state, next to, I believe, Darke County. So it will expand the fairgrounds. It will add a beef barn, an expo center, which they plan to utilize for, weddings, to car shows, to all kinds of events, and of course, make the fair more, even more attended than it is. I know Lorain County needs a county jail.
Okay.
One preferably with an infirmary or healthcare type of facility that the current jail does not offer. So that will be definitely a big need. Those are really, I think, the two biggest ones
Okay.
for the capital budget.
What is the first action you will take once you're elected?
The first action I would take would be to, and this will be controversial, but elect a Speaker of the House that it was elected by the majority of the Republican caucus. Unfortunately, that did not happen this General Assembly. And while I know many of those legislators and have worked with them and have a great deal of respect for many of them, we have a supermajority of Republicans in our legislature, and we're not getting conservative legislation passed because of this issue, and it's unfortunate. So I would say, if your question was legislatively, it's hard to say with certainty what I would do. I certainly have things that I would like to work on, but you have to have a reasonable amount of support. So I'll do a litmus test and see once I get to the legislature and I have established some relationships with people, I'll see which one of my endeavors would have the most reasonable amount of support to pass. And if it doesn't have a reasonable amount of support, I probably won't introduce it. But a couple of things that I'm interested in are getting the Honor and Remember flag recognized by the state of Ohio, as it is in 20, I believe, 4 or 7 other states for our Gold Star families. That was something that a district member asked me to take up. Our military members, they do not have the ability to recoup time with children that they have custody of, but are not married to the other parent while they have military duties. So they just lose that time with the kids. They're not owed that time back. I think that's something that needs addressed, as well as many healthcare barriers still exist for providers in the state of Ohio to practice to the top of their license, training, education, and certification. So that will be something that I work on on an ongoing basis. And lastly, as a result of the opioid crisis and the continuation of the opioid crisis due to the amount of illegals that are coming across the border, to the tune of 10 million in the past 3 years, it's bringing with it, human trafficking and fentanyl in large numbers. And that fentanyl is being put into counterfeit medications such as Adderall, Xanax, and oxycodone and Percocet, and it's being given to people with the understanding that they're taking that medication, when in fact it's 100% fentanyl, and that's deadly. So we don't have drug-induced homicide in the state of Ohio. It is my opinion that act is drug-induced homicide. I personally know people who have lost children with children who did not have a drug problem.
Right.
And those are documented as opioid overdoses, not as homicide. And in talking to some prosecutors and some law enforcement, they don't have the tools and the laws on the books to address these things in a manner in which they should be. So I would like to look into that.
Okay. Well, I think you're showing the audience that I characterize you as wise, and I think you're showing some of your wisdom here.
Thank you.
What is your vision for dealing with the upsurge in crime that's occurring in U.S. cities?
I think that, again, a lot of it goes back to the illegal invasion that we have.
Okay.
As a state legislator, I can only make laws that, facilitate, I'll go back to the drug-induced homicide example, right? Our prosecutors and our law enforcement don't have the laws on the books to address those things, so we chalk it up to an opioid overdose. So I think, from a legislator's standpoint, I don't really have the ability to locally fund police, safety services. That's more of a municipality.
Yes.
At the state, we fund the state highway patrol, and this is certainly not a time to, take any resources away from our safety services.
True.
So, anything I can do in that regard, I will absolutely be committed to doing. But, we can only look at laws that, would help with crime.
Yeah, provide tools for law enforcement.
Yes. Yeah, and I would work with law enforcement on, what tools that they need from us. So.
Okay. How would you deal with having biological men competing in women's sports?
So there is, there was House Bill 61, which I supported fully. Representative Gary Click introduced and passed that bill this General Assembly, and it did prohibit men from participating in women's sports. I certainly fully agree with that measure. It was actually vetoed by our governor, and the legislature then overrode that veto, so I was thankful for that. But I fully agree with that measure.
Okay. What do you think about Lorain County Joint Vocational School approaches to education?
I support all vocational school. We have, EHOVI. It's just outside my district. It's also a vocational school, and in my district would be, Lorain County JVS. I fully support vocations, especially in this, day and age. We need welders, and when I grew up, it was highly encouraged. You had to go to college. You had to go to college.
Yeah, right.
And now we see the opposite swing,
Yeah.
which, if you have any business mind about you, you can be an electrician, a plumber, and just the sky's the limit. It's, college isn't necessarily the smart thing to do at this.
For everyone, yeah.
Correct.
As a representative, what can you do to stimulate business development in Ohio?
Sure. So economic development, I think we're doing a decent job in Ohio with encouraging economic development just by our tax structure. That we've really been on a trajectory to lower taxes in the state of Ohio, and we've been doing a good job with that over the past 10 years. And that will be evident with Intel coming to Ohio. So I think we're doing a good job currently. With the trajectory that we are on. There is a measure that was introduced just recently to remove the state income tax. That would probably help. However, I would really need to see, the plan on how that is going to be rolled out, and how's that going to affect the middle class and the poor individuals in the state, and see a fiscal impact statement done by the Legislative Services Commission before I would fully say I'm behind it. But either way, continue to cut taxes, and I think that where we can, without hurting, too many people in the process, there's always going to be an argument of what's the fairest way to cut taxes. Is it sales and use, or not? So
Okay.
that's a whole nother conversation we could have.
Yeah, you bet. Another hour. Are we winning the war on drugs?
I would say we are not winning the war on drugs by any stretch of the imagination. We spent billions of dollars,
right.
But again, trial and error, lack of understanding. I think we're on the right path, though. I don't know that we'll ever necessarily win. I think that's just
Human nature.
A poor use of, or a poor analogy. I think legalizing marijuana, I think, will help some. Not that I was not in support of legalizing marijuana. However, decriminalizing it now that it is legal, I think will help some. And I'm sure we'll talk about marijuana more here as we go, through the program. But there's certainly not a singular answer. But we do need to continue to focus on mental health and addiction services, rather than the criminalization.
Kind of alternative approaches.
Yes, and I definitely don't want to contradict my former statements regarding my support for drug-induced homicide. I think that's different. I think that's bioterrorism. I think that's not opioid addiction.
Yep,
but opioid addiction, and addiction to any substances, it has to be addressed from a mental health and addiction services standpoint. If that fails, are there some avenues for criminalization? Of course. But we have to keep going back to that mental health and addiction services to really
Okay.
treat, because it's a medical condition.
Understand. Now, we talked a little bit about marijuana. What has been learned from the states that have legalized marijuana?
Sure. So we'll just use Colorado for an example. Like I said, I wasn't in support of legalizing it. Just from a standpoint of mom, wife, healthcare provider, essentially, I tend to look at things through a scientific lens. So we know that, use increases 24%. We know that traffic accidents go up well over 200%. ER visits go up significantly. So, that's what I see in my daily life. And so, and I don't want, we know that use increases in, adolescence, and that is when their development and their brain is what we call neuroplastic. So I don't like to see that portion of it. But, conversely, the sky did not fall, whereas a lot of, opponents said that's what would happen. That did not happen. In terms of, finances, it doesn't really help states that much. It's a very small fraction of their budgets, the revenue from it. So to me, that's not an argument. It's not a proponent argument, but
Okay.
Those are the things that I'm familiar with that have, shown themselves from legalizing in other states.
Okay. Are victims and accused rights balanced under the law?
Constitutionally, yes. In the Ohio Constitution, they are, I believe that's Section 1, Amendment 10A, I believe. Victims' rights are supposed to be balanced with the accused, which are accused rights are federally, and victims' rights are a state constitutionally provided.
Okay.
So they're supposed to be. Depends on if that's followed or not at the local levels, and I'm sure there's arguments for and against that, but constitutionally they are supposed to be balanced.
Okay. Should police officers have qualified immunity to avoid personal liability for their on-duty legal activity?
Absolutely. Absolutely.
Okay. Do viable alternatives exist for cash bail?
The options I'm aware of that are alternatives for cash bail are surety bonds. People can put property, their interest in property up. They can be released on their own recognizance. Those are certainly alternatives, when appropriately used.
Okay.
So.
How are the rights of poor defendants, how can they be assured? Does a double standard exist in our justice system?
I don't know that anything can be insured 100% of the time. We provide the structure and the framework for things to be insured. Whether or not that's carried out, we can't necessarily insure really anything. But I think we've done a good job of providing the framework for things to be fair and as fair as they can. Fair, again, that's subjective. So we create minimum standards, right? A fair trial. We offer a poor defendant the right to a fair trial and the right to,
An attorney.
an attorney. And, if you compare that to a wealthy defendant, they obviously would have more choices in utilizing, what may be a better attorney. So is that fair? I think that's subjective, but I think fair is a minimum standard, and we provide the minimum standard because I don't think it's the government's role to necessarily provide anything beyond the minimum standard.
Okay. Should convicted felons have their right to vote restored in Ohio?
Once their sentence is completed and they've fulfilled whatever it is the judge sought for their crime, I believe they should have voting rights restored if they've successfully done so.
Okay. Tell us about House Bill 8, which is the Parents' Bill of Rights.
Sure. House Bill 8, which was introduced by Representatives DJ Swearingen and Carruthers, has passed the House. and I believe that it's just stalled there due to some dysfunction that we have in the current legislature between the House and the Senate. I don't believe it's moved anywhere through the Senate yet at this point. But the premise of the bill is to statutorily ensure that parents have the fundamental right to be a decision maker in their children's well-being, education, and care.
Okay. How about House Bill 183, the single-sex bathroom access?
Sure, and that bill, I would have liked to have seen that measure in with the earlier ban that we talked about in House Bill 68.
Right.
But that is very common sense legislation that should, again, fly through a Republican supermajority. I don't know that it'll get moved yet in this General Assembly, but quite simply, and of course I support this bill as well as House Bill 8. It just simply makes bathroom use exclusive to biological males and biological females.
Okay, you keep using common sense, and that's good. What about Senate Bill 215, the foreign national contributions for ballot issues?
Yes, that bill passed the Senate, and certainly support that measure. Prohibits foreign nationals from contributing or making an expenditure toward a local or state ballot initiative or issue. There was a House version, House Bill 114, that was added and amended into House Bill 114. I went to the floor. Well, it was supposed to go to the floor, the House floor this past week, and it was not put on the floor due to that amendment being in there, unfortunately. So again, this is a very important issue, especially with the anti-gerrymandering amendment that's likely to be on the ballot this November to be a constitutional amendment. Okay. And that most likely would have prevented the issue one from last November as well. We have all this foreign money coming in and affecting our constitutional amendments. So I would love to see that pass.
Okay. What campaign activities have you conducted, and what are your future plans?
Meet voters, raise money. Those are, for a campaign, those are the two fundamental things of a campaign. Meet voters so that you can understand that their needs, how they want to be represented, how they need to be represented, how they're best represented. And so I attend probably between 2 and 4 campaign events per day. I'm just trying to hit every sector, safety services, all the law enforcement. I went to the prosecutor's office this past week, met with victims' assistants, things that I wasn't really necessarily aware of before that I need to be aware of now, entering the legislature and possibly becoming a lawmaker. I think if you just do those two things and you be mindful of how your district wants to be represented, I think that you can be successful in this role.
Oh, how are you funding your campaign?
So initially in the primary, I relied on the medical organizations that I did work for in the past, and they knew me as an asset because they had seen that I had passed legislation before, and that legislation was, it didn't advance me personally in any way. It only allowed me to take care of patients and advocate for patients. So there's no personal gain in any of the legislation that I've partaken so far. But those organizations, they saw the grassroots initiative and that I, carried it through to completion, and it took 6 years, and I was in it for the long haul. So, they were able to gain enough confidence in me to financially support me. So a lot of healthcare providers, both doctors and nurses, supported me, and a lot of the legislators actually supported me as well. So now, once that the primary, I did well raising money. Things have slowed down a little bit more for the general, and now I'm focused on making local relationships. Especially in Lorain County because I'm not from Lorain County. So, I'm really looking for more financial support from members from Lorain County. That helped me and just go from there.
Okay. Now, in a minute, I'm going to ask you what your website is, but there's a donate button on that.
Sure. Yes, there is. My website's Kellie, Kellie, Deeter, DEETER.com.
Okay. How can someone get in touch with you?
So on the website, there is a link to my campaign email address, which is Kellie Deeter for Ohio @gmail.com.
Okay. And that's FOR?
Correct, yes.
Okay. How can residents support your efforts? Do you need volunteers?
Yes, my website's currently being worked on as we speak to put links for fundraisers, events. I will probably have some town hall events that we kind of structure into the campaign so that people can get out and meet me from now to the general. And there will be a volunteer sign up on the website as well, and an area too for if you want yard signs. We can get yard signs.
Okay. I ask this of every interviewee. In summary, what makes sense to you and what doesn't?
Oh boy, what makes sense in terms of the state of Ohio?
Yeah.
Hmm.
In general, you can.
What does not make sense is healthcare laws.
Okay, all right.
No healthcare provider should be restricted from practicing to their national certification.
Okay.
So that is a no-brainer. We have a lack of access problem, lack of access to healthcare problem. We have soaring healthcare costs. This is a simple measure that will not reduce outcomes. That all the data in the world is out there. There's no reduction in outcomes for patients. In fact, there'll be an improvement in outcomes for patients and a reduction in costs. So the regulation as it relates to healthcare does not make sense to me in the state of Ohio. And what are we doing well? That is a tough question in this current climate with our legislature. The Senate's doing very well. They're just very cohesive, and they pass common sense legislation.
Okay.
Our House, they need some work.
Problematic.
They need some work. They need some work. But things will get better. Diversity of thought is good, and sometimes our nation is young yet. We're in our adolescence, if you will, as a nation. So you go through these growing pains, and then you come out on the other side, hopefully better for it.
Okay, and you'll be there to help things along.
That is my intention. That's my goal.
Well, thank you for appearing. I think the residents of the 54th House District should be grateful to have someone of your caliber, experience, knowledge, wisdom, and common sense.
Thank you very much for having me. I really appreciate it.
Okay. And thank you for watching. If you want to get in touch with any of us, make comments, ask questions, our contact information is at the bottom of the screen. If you are someone who wants to be on the show, or interesting people, please forward us their contact information, and we'll take it from there. And remember, seatbelts save lives.
The preceding program was presented to you by a community producer. The statements, views, and opinions expressed were not necessarily those of ALC TV or the City of Avon Lake.